Hey, wait, why do I always say that? This week in pharmacy. It's like two this is this. This is TWIRx. Welcome to the show. Very special show today with my friend, Pharmacy 50 most influential for, I think it was the alumni 2025 class, Shane Jerominski. How are you?
What's going on, Todd? How are you? Nice to see everybody.
Hey, we have two returning guests to the Pharmacy Podcast Network, and it wasn't called TWIRx back then. I didn't have my own podcast until I had TWIRx because the network was supposed to be off by itself, and I was supposed to have hosts come in and talk about specific things. So I get my very first podcast of doing this 17 years back in 2023, and Claudia and Bev, you haven't been on TWIRx, but you were on other shows that we've had. So welcome back to the Pharmacy Podcast Network.
Thank you. Thanks for having us.
Claudia.
Hi, thanks for having us back.
Absolutely. All right. I want to start with the two of you. Bev, you were the first guest that I had back, you said, in 2020. It's making me feel old because of how fast time's going.
Yeah.
But set the stage for us. Tell us who you are, a little bit about yourself, and your relationship and partnership with Claudia.
So my name is Bev Schechtman. I am the vice president of the Doctor Patient Forum. I first reached out to Claudia in 2017. We both have Crohn's disease, and she was on a Crohn's group on Facebook after a horrific hospital stay where I was denied opioids for kidney stones because of a question I answered on the opioid risk tool about pre-adolescent sexual abuse. They used that to deny me opioids in the hospital for kidney stones. I reached out to Claudia. Don't Punish Pain Rally started from that, and then where we had rallies in all 50 states. And then the Doctor Patient Forum, I think it started 2019, something like that, the nonprofit. And I do a lot of the research and the back end stuff, a lot of the putting together the videos, taking clips, listening to all the CMEs. And Claudia does a lot of the front face stuff on social media where she gets to get attacked and I get to sit back and not get attacked.
Listen, Claudia is like a social media / media, and it wasn't even called social media when Claudia first started doing this. You are a powerhouse when it comes to media, even if you weren't talking about pain management. If you were out talking about, you were one of TMZ's, reporters or something like that. You're just a good reporter of what's going on, and you do it with passion for patients. So give an introduction of yourself and what you do.
I think I'm so passionate because I'm a theater kid, and I think theater kids are always going to be a little more passionate than, people who. I spent a lot of time in the theater, and I'm an Italian Scorpio, so I am 100% passionate about what we do. There's a growing suicide list. I went on social media 2000. Gosh, I think it's 2017, and I announced I would organize a national protest for people who couldn't get their pain treated. Fast forward to today, we have about, I don't know, altogether people who follow us on TikTok, Facebook, probably 700,000 who follow our efforts. We've got chapters in all 50 states, and I am primarily the spokesperson. So I'm the person that people see on a regular basis. And I think, why we're all here today is because of a video that I made several weeks ago. My job is to make videos, get the message out there. I don't have an easy job. I have the job of telling people to make OxyContin great again, which is triggering for a lot of people, but we've got to stop the bleeding. So my videos can be extremely controversial to people, and I understand there's some big feelings with my videos, but I made a video in response to what I'm seeing on social media with a lot of the younger PharmDs, and it was just very scary to me, a bit appalling, because so many of the younger PharmDs were boasting about not dispensing pain medication. And I had texted Bev and I said, there's a theme here. They're never talking about withholding abortion medication or Suboxone. It was always confined to, this is why I'm not going to fill pain medication. But there was like a sense of arrogance in some of the younger PharmDs. But let me say one thing, I have immense respect for the pharmacist role in medicine. I've got a friend whose daughters worked very hard to become pharmacists, so I have a healthy respect for the pharmacists. What I don't like is I don't like to see these arrogant PharmDs on social media boasting about not dispensing pain medication and accusing people of being drug seekers, which is why I made the video. And the message I had to make the video. It's my job to raise awareness to every aspect of the pain patient being attacked. And I think, let's face it, that's why we're here today. Many PharmDs were outraged by the video, sparked a lot of controversy, but not one pharmacist was willing to acknowledge that we have a problem. They all, they all stitched the video. I was slaughtered on social media. I'm unfazed by that. My job is the voice and the face. So,
Yeah.
but then it took a nasty turn, as it so often does on social media. Once again, I'm not fazed by that, but I didn't know Shane was the accidental pharmacist. I think a pharmacist said that somebody was wishing ill will on his wife. And I don't know if that was you, Shane, because I'm not tech savvy, which a lot of people find this hard to believe. I'm the spokesperson, and basically Bev does all of the heavy lifting. So I'm awful sorry if that is you, Shane, and if somebody was saying ugliness to your wife. I'm on the same end that your wife is on. So, but I'm awful sorry that happened. But how can we, that's for a different show. But I do want to say, if anybody was wishing ill on your wife, that shouldn't have happened.
Well, thank you for saying that. I appreciate that. And it comes with the territory. You're absolutely right. You and I probably agree on a lot more than you would imagine. Claudia, I am the same thing. I am the mouthpiece for a lot of areas in pharmacy. And I say some of the things that need to be said that a lot of other pharmacists won't say because they're tied to a corporation that would fire them immediately. So I have become the default face in some situations. And I do, first off, let me say I respect the idea of saying those things that need to be said, to creating a space for discussion, bringing two what seemingly opposing groups coming together to have that discussion is important. And what you did, you said you're a theater kid, and I can see it, but what it is like a little bit of sensationalizing. And sometimes sensationalizing is necessary, but it is a little bit of that.
I don't know. I don't feel like we sensationalized. I think that people don't understand that our passion comes from the fact that every day, all day, literally every day, all day, our inbox is flooded with messages from people with a gun in their hand, ready to end their lives. Like, we are not being sensationalistic. Yeah. The fact is, it has been left up to pain patients to fight for patient abandonment, forced opioid tapers, harms from the PDMP and analytics and lack of continuity of care, when there's an entire industry fighting for people to have access for medication for opioid use disorder. This has been left up to us. People reach out to us for their last resort. We've had people reach out to us that we knew were going to kill themselves that ended up killing themselves with their wife in a double suicide. So I don't feel like, I know that part of maybe it's a bit of the younger generation of like trying to sensationalize for social media. We actually don't do that. That's just not, we really don't. These are this is real life for us. Like, for us, it's not, I'm not saying it's a game for you, but for us, it's not about making memes. It's not about creating waves. It's not about, having a meme with a cigarette. Like, this is real life for us, and we're the only ones fighting for this. And we have no voice other than us. There's real stories behind all of this. But when you say something like "make OxyContin great again," that is triggering, and it's also sensationalizing, in my opinion, because to go online and say the answer to people with guns in their heads is to make OxyContin great again does not sit well with the healthcare community.
Yeah.
Oxycontin has a very good place in that. I'll let Todd
Yeah.
bring this in because
Yeah,
I think
let
we're
me-
getting off.
Let me do something, because both of you, Bev and Claudia, I want to thank you. You set the stage for what I'm trying to pan out for both sides, so that there's audiences that Bev and Claudia are bringing to us that we don't normally get. And I just want to say thank you both. And I also want to shout out to those people listening, those pain patients. This is ultimately about bringing relief to you and management of your pain and being empathetic to what your pain is. Remember, guys, I've said this to Claudia and Bev before. I'm the patient on this show, just like you are. I mean, I'm not a pharmacist. I'm not a, I'm a technologist and marketer and somebody that's been in pharmacy for a really long time and sees what pharmacists are actually doing. But before we get into the I want this to turn out to be a movable debate. I want to just set some basics, and that is, the two of you are exposed to people that are, for lack of a better word, they're bleeding inside. They're in literal pain. They don't know what to do, and you experience this on a constant basis. Boom, 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 and it's very intense. And by the way, dentists are known to want to leave the profession because when they inflict pain on, there's a whole psychological write-up on this. When they inflict pain on their patients, and they could see grimacing of the face, it literally took an effect on these people, because I think it's like a human thing. You can't help but you see somebody in pain and you're less like, fuck, like, let's get them some help. Look, they're in pain. So we know that you both are sincere in that, and people can look you up on social media and see that passion. Now, I want you to turn off your pain advocacy hat for a second. I want you to come to Pharmacy Land. So there are listeners that are raised in different generations. I'm closer to your generation, like I said, Gen Xers, and we just think a little differently than what I see millennials and definitely Gen Z thinking about. But there is a pharmacist out there. It's a story that she watched her dad as a pharmacist, and she wanted to be nothing more than be a pharmacist. And she watched her dad bring in people with problems. They had, ailments, leukemia, and like compounding medications and specializing. And she grows up seeing the impact that he has on people's lives. He knows them by name. He knows their family history. He knows if little Jimmy's lying, like the whole thing. So the whole fundamental of starting this all off is pharmacists and what their purpose is, what their goals are as healthcare professionals, because they've dreamt about becoming pharmacists since they were like little kids, or something that they're working on. And in that batch of people, out of the 330 million Americans that they're taking care of, at least in the United States, obviously much more worldwide, their whole existence in their nerdiness of doing it, they want to take care of seniors. They're the pediatric specialist. They're the community pharmacist that's doing more of like the whole tackle box of stuff. There's the researchers and the medical science liaisons. What they have in common is that pharmacological study of how medications literally work on the DNA of individuals in transition and titration and compounding, and your enzymes and your pharmacogenomics, and how your genes respond to opioids. And oh my goodness, this could become a new podcast show for the four of us of how long it would take to get all of this out. That's what they do.
You're right. There's a lot to this argument.
Yeah.
But I think the one thing that's misunderstood, and this is where I'd like to start with this, what's misunderstood about opioid therapy is we've turned it into a binary argument. We've turned it into either opioids are dangerous drugs that should be avoided at all costs, or opiates are essential medications that should be dispensed without question by pharmacists in every situation.
Who is saying that, Shane? Who is saying, because that's what you've attributed that to us. You've made memes about it saying we want everyone to, who has ever said that? Because we've never.
You guys keep pushing up that report from the American Medical Association, which essentially the AMA is advocating, the the article talking about how the AMA thinks that pharmacists are withholding drugs and using their clinical judgment to supersede anything that that comes out there.
Yeah.
And they're using an example of an ophthalmologist or an optometrist who wrote, ophthalmologist who wrote for a cream for rosacea, and the pharmacist denied the prescription. But then they go on to like they're trying to change the law to say that pharmacists can be held legally responsible if they don't dispense the medication.
Well, so let me clear this up now, because it's probably better at the beginning. We have never advocated for opioids to be first line, second line, third line, or on their own. Not one time have we ever said that. We have a very healthy respect for the possible harms and benefits of opioids.
Can I just say one thing right there? Someone who has a healthy respect for opioids wouldn't have a mantra like make OxyContin great again.
That's not true, because here's the thing, Shane, there's two separate issues here, okay? When you have an opioid naive person, there's a different set of rules as far as someone who has been what they call a legacy patient who has been on opioids.
For sure.
17 studies show, regardless of dose, duration, or combination of medication, it is always more harmful to cut a patient off of opioids that has been on them than to let them remain on them. The patient population we are fighting for the most part, are is that population where maybe they should never have been put on opioids to begin with. But that's actually moot point at this. It's actually a moot point, because they have been on them and they're becoming abandoned. They're on higher doses that maybe they should have never been put on. But the fact is they have been. And so for pharmacists to joke and make fun on social media saying, oh, my patient on this amount of medication, I'm not going to give it to them, like it's a joke, when these people are going home and we have so much evidence behind, do not force taper these patients. And that's the difference. Like, make OxyContin great again, because right now, everything has been about vilifying the full agonist. Everything. And, we've said that pharmacists, we've gotten from you guys like, oh, well, how come, don't fight the DEA, it's not our fault. But when it comes to Suboxone, the NABP and the NCPA, their MOUD guidelines, they know how to fight for Suboxone. They know how to fight against the DEA. The pharmacists know how to fight against the red flags for cash only pay and distance from patient to provider when it has to do with a certain population of people. And when it has to do with pain patients, all of a sudden, the suspicious order reporting, the NARCS care, the PDMP analytics, the cash pay, the red flags, the DEA, all of a sudden, that becomes our job to fight. How come you guys, pharmacists in general, will fight for one group of patients who have a voice? These people have key opinion leaders and money and a platform, and will not.
You really got to the root of the problem. And I think this is one place we are both in absolute agreement that pharmacists are trapped inside a system that is making it easier for us to dispense a drug like Suboxone than it is for us to dispense a full agonist opioid. And the reason why you're not saying individual pharmacists, but you were talking about organizations that are advocating for this. And the reason why those organizations are advocating for this is because the money they're taking from companies like CVS and Walgreens, there's liability that exists with full agonist opioids that don't necessarily exist the same way with things like Suboxone. So I am in agreement that you follow the money, you will find out the reason why it looks like this.
100%.
What you did say that I can disagree with is that pharmacists are going online and laughing or making light of withholding medication. And I'm advocating for those patients. You said what you called legacy patients, or non-opioid naive patients that have been on opiates for a long time. The risk of tapering, the risk of cutting them off is terrible. But we're in a situation here where it's easier for us to pass the buck, where it's say we don't have it in stock, and a lot of times we don't, thanks to the DEA cutting supply of that. Now that the wholesalers have been
will just
fined,
cut you off.
yeah, wholesalers will cut
Claudia,
you off.
you guys know that? Do you know that if you own a private pharmacy, Claudia's Pharmacy, right?
Yeah.
And all of a sudden you get an email out of the blue where they're like, oh yeah, no more.
Oh yeah, we hear
we know that.
And we hear from independent pharmacies on a regular, and we did meet with Senator Sheldon Whitehouse 2 weeks ago to discuss this problem. And
there's handcuffs on them.
Yeah, there was
I
so
get
much.
it, but the
So,
organizations,
so-
pharmacy organizations will fight against the handcuffs for Suboxone and not against opioids.
For sure.
That's my
And
point.
you're right, and that's a great point taken. I work for independent pharmacies, and the one that I work at primarily is we service hospice patients. So we have end of life care, really high dose medications, and every single month we're fighting with McKesson because we're reaching our limit for
Yeah.
liquid morphine. We're reaching our limit for benzodiazepines, and I've had to justify our ordering to a non-pharmacist that works there just in regulatory compliance, and they're saying, well, why are you dispensing this much? I wanted to say it's because we have fucking contracts all over the desert for patients that are at palliative end of life care. Why else do you think that we're doing this? So we have multiple masters that we're reporting to now.
Yeah.
And
Yeah, look,
you
I
know,
showed you.
pharmacists have so many things that they're fighting for, and I
Sure.
don't want them to think that pain patients aren't important to us. I just want you to understand that we have so many different things that are going on. My realm, I've been drawn into this argument because of my platform on social media, but I would never I'd never called myself a pain advocate. I called myself a workforce reform advocate, because I was trying to advocate for giving the pharmacists and the people behind the counter enough space to do their job appropriately. If we weren't so overwhelmed, if we were better staffed, if we had the resources to take time with every single one of those patients that are legacy opioid patients, to make them become, instead of customers, patients. You understand, we understand patients. When they're just a customer, like the way it is in a CVS model, where every time you go in, you see a different pharmacist. Every time you go in, you feel like a cattle being that they know nothing about you. Then you're a customer. You're not a patient. But when you're a patient, you're never going to be denied, because we're going to do the extra work to make sure we understand why you're on what you're on.
True.
Make the annotations, put in the notes, call the doctor's office, make sure that even when they're not there, the primary pharmacist isn't there, you can look at that patient's profile and understand why the drugs are written the way that they are.
And think of the attitudes, like Claudia, you brought up kind of the snottiness and the disheveled looking, pharmacist. And once again, I kind of started this out. Let's pull this whole conversation out on its head from a generational perspective. I think differently than other generations do. So if they're being smartasses, or they're kind of being, pushy about cutting something off, even if they said that, which I would shame them if that were the case. It's like it could be like one or two jerkos that maybe have an attitude about something. They don't understand pain management because they've never really experienced themselves. So when you take an entire industry instead of those individuals, and you promote to the power that you have, as we were saying, in media, and now we know you were in theater. My daughter's in theater and I was in theater. So yeah, I get that. When you're pulling all of that attention and you start labeling them pharmacists, and then of course they have to experience and try to start putting the jigsaw puzzle pieces together, but they only have 10% of the information, which is the most important part because it's their pain. But they have no other idea that the other 90% of the whole system to get them their prescription, their opioid prescription, is under attack of like 22 systems that all come back to the freaking pharmacist. Like, and that kind of pressure on top of the and this is a call out to independent pharmacies, by the way, because if you want really good pain management, go to an independent community pharmacy and sit down with them and slow down the process and stop fast fooding medicine. I mean, this is freaking pain. Let us dial into it and maybe add stuff to it or subtract stuff from it or whatever it is. But personalizing it, that isn't a Harmacist. That is a pharmacist.
But who
Like,
said
that's what-
pharmacists were all, Todd? Like,
I
her
know.
video literally said the part that was stitched is the problem, because what her video said is, I'm seeing a number of younger pharmacists who I'm going to call Harmacists making fun of
Mhm.
patients. That's what her video said. But the stitching part, it's like, to sensationalize, they wanted to make it look like she said an entire industry. Look, we've had pharmacists on our podcast. We fight for pharmacists all the time. We never said an entire industry. What she said and what we've said is I am seeing a number of who are doing this. And it's not just pharmacists, it's nurses in the emergency room, it's doctors, it's nurse practitioners. They make fun of pain patients. They make fun of denying them opioids in the emergency room. They make fun of denying them in the pharmacy. They make fun of cutting them off. They mock them for fun because it's sensationalistic. But we never, ever once said an entire industry, that's what was portrayed by those who wanted clicks and likes by stitching a portion of her of her video.
I think that they latched onto it because there was a touch of irony to it that, you know, she was saying, she ultimately said Harmacists, and she talked about younger pharmacists looking like unmade beds and unkempt, and they were passing judgment by their outward appearance. And I think that you would in the same breath say, so many pharmacists out there are passing judgment by the outward appearance of a pain patient. If they don't look like a classic pain patient, if it's pain that you can't see, if it's invisible, and then they come in and they have this high dose drug, you're going to start asking questions. And the thing is I think that asking questions is not evidence of arrogance or cruelty. That's something that's really important. Let me say it one more time. Asking questions, a pharmacist asking questions is not evidence of arrogance or cruelty. It's part of our job.
We never said it was, Shane. And this is why when you made the meme or whatever saying Claudia wants us to just fill whatever that was, roll up in the car, whatever one of the memes you made, that we just want unending doses. That's really not fair. And it's actually very harmful to us because we have never, ever one time advocated for anything like that, nor would we, because it can harm patients. Yeah. And so the fact that you say there's like, it's binary, it's not binary. I actually haven't seen any patient advocates or doctors advocating for pain patients say unending doses all the time, no matter what the dose to everyone, or none. Like, I really don't see that very much. I haven't come across it in our advocacy. We certainly have never advocated for that. But it's being portrayed as though we do, to kind of almost as a straw man to attack us as though we want everyone to get opioids all the time for everything, and that's just not the case.
Well, when you're saying that, in one thing you're saying that you don't want just patients to get opiates for everything, you're vilifying all these other drugs. You're saying that gabapentin has a whole list of side effects. You're saying
Sean,
that
I'm sorry. It's Shane, right?
Shane, yeah. I get Sean all the time and Jane on the phone, so don't worry. I respond to any one of them.
So I have a 25-year-old daughter and a 21-year-old daughter. And when my 25-year-old daughter walks out of the house and looks a certain way, I say, you're not leaving like that, are you? Are you angry at yourself? Get back in, fix yourself up. So I'm showing my age. I'm 58 years old. So I probably think a little bit differently than you do, maybe even a little bit differently than Bev does. I'm 10 years older. So with each generation, I think we learn a little bit more. I think what was sensational was hundreds of pharmacists stitching my video, accusing me of being funded by Purdue Pharmaceuticals. Let's be honest here. If we could just be honest for a minute. How dare pain patients have a voice? And when we do have a voice, the default is always to say that we are funded by Purdue. I mean, I've got a doctor who made an account on X calling me Karen Sackler. So I think it's just so easy to assume we're funded by pharma because of our advocacy. What wasn't funny is when I was accused of drug seeking, and because of that interaction, I left the hospital with a colostomy bag. Yeah. And I think if the PharmDs who have stitched my video and mocked me, I think if you folks walked a day in my shoes or Bev's shoes, you'd probably look at it a little bit differently. I think so many of the younger PharmDs are viewing pain through the lens of addiction, and I'm confident that your education has a lot to do with this. We know what's going on. I'm in Rhode Island, University of Rhode Island. I've met with these students, and they're telling me what they are being taught. We've skewed. If somebody needs pain medication, we're always going to the place of these are drug addicts, because so many people are getting their science from that fictional series Dope Sick. My 90-second, I think my video is 90 seconds. Because I'm the most visible, I'm always going to be the person that gets attacked the most, which is fine. But I think PharmDs also put their touch on my words. My words are always being weaponized. But we have a very serious crisis on our hands, and many independent pharmacies have reached out to us over the years. There are pharmacists incarcerated with some of our doctors. So we understand every aspect of what the pharmacist is going through, which is why we routinely meet with senators who conduct oversight of the DOJ, because that's what we need. We need a DEA oversight hearing, and those are the people in the United States who have the power to make this happen. And so many PharmDs, well, what are you doing? Why don't you challenge the policies? We do challenge the policies. I got a law passed, so 49 states would take a version of my bill and, tailor it to their state. We're only 2 people. I can't be in all 50 states. I can't be the voice for pharmacists, but we are making headway, which is why we're meeting with these senators. And if you're a PharmD who's listening to this, please support our efforts, because I would like nothing better than to have 50 Claudias, 50 Bevs in all 50 states where they can meet with their senator. I think we've got 20 something senators who conduct oversight of the DOJ. That's what we should all be working towards, is removing these red flags. The red flags have caused red flags. Suboxone has become the savior. OxyContin has become the devil. And we need to get back to a place of normalcy. We certainly don't advocate for unfettered access to opioids, but because we advocate for opioids, and because people are getting their science from the fictional series Dopesick, that's how this comes off to people. Like, how dare you advocate for pain medication? How dare you want to, how dare you mention gabapentin's link to dementia? How dare you mention Suboxone's link to catastrophic dental decay? I don't get money to promote any of those lawsuits, but once again, I have a job to do. My job was to let our followers know 65 million scripts, I believe, were written for gabapentin. People have a right to know if you're experiencing cognitive decline and you're on GABA, it's something to look into.
Yeah. And that's to address, and to address what you said, Shane, the reason we so-called vilify those things is because an entire industry that we call opioid elimination has been made out of eliminating opioids, right? And I think when anyone is getting any medication, whether that is Remicade or methotrexate like I get, or Cimzia, or opioids, or Suboxone, or gabapentin, or even a medical device, everyone should have informed consent. They should be told possible harms and possible benefits, period. That includes addiction risk, but the accurate addiction risk, not upstated or overstated. That includes dementia risk. That includes all of it. And what's happening that I don't think, maybe you don't know, maybe you do know, but maybe you don't know, is that patients are being extorted. So what happens is pain patients are being told at these interventional pain clinics, they'll be told, listen, you can get your 15 Vicodin a month, but you must get these procedures, epidural steroid injection, you must take gabapentin, you must take Cymbalta, you must see a therapist, you must, and they tell them nothing about possible harms of any of those things. Sure. And that's the problem we have. The reason we're talking about harms from those things is because they're not being told to the patient. We don't have to talk about the harms of opioids because it's everywhere. Literally every day, everyone's talking about Purdue still.
Those things should be explained to the patient. And if pharmacists are doing their jobs, if doctors are doing their jobs and working together, those risks are explained for everything. And let me start. There's a lot to unpack in those 2 things you said. First of all, pharmacists are not getting their science from stories like Dopesick.
No, I didn't know. I wasn't. No. I was.
I understand that the general
general
public might see something like Dopesick and say, "Oh, everyone who's on opiates is drug seeking." But it does show the risks of what can happen for the wrong patient starting on that or staying on it for an extended period of time.
But why aren't we talking about the risks of somebody being on Suboxone for a long period of time?
We should be.
I want to ask you, what do you think? What were you taught is the addiction risk of a patient on long-term opioids? What would you say in the most recent studies is the risk of addiction?
what would I say the most recent?
In the most recent studies, like the most recent statistics out there, what would you consider a percentage of risk of addiction for a patient on long-term opioids, chronic opioids, however you want to say it, for pain? What do you think the risk of addiction is?
Like how many people do
Like
you
what
think get
percent?
addicted?
Yeah, what
What
percentage?
percentage?
I mean, I don't want to throw one out there because I'm sure it's, I think that let's go back to where you were talking about how in our, you said at University of Rhode Island that these students are being taught to vilify OxyContin and really push buprenorphine. I think that it's not just that. I think that what students are being taught in school is that their license is at risk for making a mistake.
Sure.
That there is a lot of liability that ultimately ends with them. Even though there are so many people in this food chain of getting the medication to a patient, ultimately it's on. And I know this because I have been in situations. My wife has been deposed because of
Sure.
patients getting things, and then families claiming that this was something that should have been stopped. And
Right.
so a place like the University of Rhode Island, where CVS's headquarters is Woonsocket, I'm sure they fund that university a lot. So CVS probably has a lot to say about what the education should look like there.
A lot of the pain education is coming from ASAM, though, from addiction medicine. But the reason I ask you the percentage,
you don't think a company like CVS though has a lot to say about that?
yeah. No, I'm not contradicting you. I'm saying in addition to a lot of the, absolutely. Oh, absolutely.
And you know, there was a lawsuit filed against CVS, Edie Fuag versus CVS and Walgreens, for the pharmacist not dispensing the medication. They had a website, Justice for Chronic Pain Patients. An attorney I used to work for, he's now the judge, or the judge that was overseeing that case. So we know this is happening.
Yeah, of course.
We know it's a problem.
Yeah,
but,
well, CVS is also, I mean, the CVS and Walgreens and all of them have also been sued
Sure.
significantly more for dispensing medication.
And those, yes.
Not,
absolutely. And those lawsuits are a big part of the problem. Like, a lot of the issue is because of those lawsuits, these suspicious order reporting and the thresholds from the distributor agreement. That's a huge, as you know, like a huge part of the problem at pharmacies. We totally understand. You don't get notified that you're at your limit until you're at your limit. And
it's
you
been every area has been overcorrected. And the only people that are really suffering here is chronic pain patients and the pharmacists who have to do all of these extra things and really end up siding it's defensive pharmacy practice is what it comes down to.
I get it. That's why the time has come for us to come together. I don't know if that's going to happen, but my work will continue. Bev's work will continue. We have to apply pressure to the DEA. That's the only way around this. And I have stayed awake at night. Okay, we tried this. There's only one solution. And Bev and I did meet with the DEA a few weeks ago, and we had this conversation. But we don't have an association behind us. It's just us. It's not only chronic pain patients. We've collected thousands of stories over the years from acute patients, went to the pharmacist said, nope, I'm not going to fill it. You're better off just taking Tylenol and ibuprofen, or nope, I can't fill this for you unless you also get this filled. Well, I don't need that. It doesn't matter. You need to get that.
Well, sometimes the insurance company is the one that's doing that. You were saying how, you know, sometimes you went to these pain clinics or whatever, and they're saying you have to have this injection, you have to be on gabapentin, you have to be on these other medications. A lot of times, if you're trying to get certain drugs, certain opiates, there might be a prior authorization for it. There might be step therapy and certain things. So that's the reason why.
I understand that.
But the reason I made the video to begin with is this really, you see this right here? This has robbed the younger generation of really connecting with people and the doctors. I've been saying this for years, you know. I have some friends, they're, you know, in their 70s who are doctors, and they shake their head. You know, a lot of older doctors contact me. I was just at a television station recording a segment, and a doctor recognized me. He's like, oh my God, please, I got to tell you what's happening to my wife. They're not willing to give her pain medication, just Suboxone. My wife isn't an addict. So, you know, everybody is going to be affected. It may not be pain medication. It may be your kid's ADHD medication. It may be My muscular dystrophy patients, they can't get their clients, I should say, they can't get their benzodiazepines. I advocated for a judge whose kid had ALS. He's deceased now, had to choose between the benzo or their pain medication. It all goes back to two problems, lawyers and the DEA. And at the Doctor-Patient Forum, we remain committed to raising awareness. We lobby for change on both a state and federal level. And if you're a PharmD listening to this, I'm awful sorry if you interpreted my video as something other than it was, but I got to tell you, every day I was seeing those horrible videos of these I would text Bev. I was like, look at this video, another one,
So
another one.
bad. It was
I would like
bad.
you guys to show me one of them that really upset you so I can see as an example.
Sure. We would love
Definitely send that to me. And you know what? I agree with the two people that you called out there, but I would also say, looking at these corporations, and corporations have gone above to protect themselves. They've given arbitrary MME limits on that.
100%.
Walmart, there are certain drugs that Walmart won't fill, legitimate pain medications for established patients. And they've said, you know what? We don't need that business. So we're going to channel that to CVS and Walgreens and independent pharmacies. And those things are really, so we have not just the DEA, not just state boards of pharmacy coming after us. You have the corporations trying to protect themselves.
Yeah.
But that's in response to the DEA and the lawyers, though.
It is, but also I think even then they like the idea of not limiting risk. Is the larger the corporation, the less they want to limit that risk. True. And if they could say these prescriptions, they're not a medication that's going to increase our margins enough for us to incur that risk. So let's push that off to someone else. Yeah. And I think the same thing happens with young pharmacists. They're assessing their own personal risk. And when you're staring down 6 figures of student debt, and you're given a situation where it's on the fence, maybe one red flag. Red flag doesn't mean that the prescription is invalid and it shouldn't be filled. But in a young pharmacist's head, they haven't seen enough of these things. They realize, okay, wait, I'm 100 prescriptions behind. I have this red flag. I'm trying to call the doctor's office. I can't get through this. It might need a diagnosis code. I don't have a lot of history on this patient because they're filling here because they're out of town or whatever. Yeah. They're erring on the side of caution, and they're doing the wrong thing for that patient. And because they realize, okay, I'm protecting myself. They don't realize they're going to send this patient away for a weekend of agony because they can't fill it anywhere else. And I always try to side with the patients when I can. I've been a pharmacist for almost 20 years now. I've seen suffering. I've seen real suffering every day, and I feel it. I'm not the smartest pharmacist to ever be behind the bench, but I feel like I am one of the most empathetic. And when I see someone suffering, I try to do everything I can in the confines of the law to help those patients.
And pharmacists shouldn't have to work under this pressure, and doctors shouldn't have to work under this pressure. One of the people from the DEA we met with, that's their job, just to go into the pharmacies and start counting, do an audit. So I know, and if I had a child that was a pharmacist or a doctor, I would probably, be sick, because I would be sick to my stomach worrying, oh my God, my kid could go to prison. But I got to go back to, because I got to stay true to who I am. Like this has been the demise. This is the demise of the world, the device. And, all we ask is, if you're a young nurse, if you're a young PharmD, if you're a young emergency room doctor, leave your bias behind before you go on social media and make a hateful video, because you are stigmatizing. When you stigmatize OxyContin, you are stigmatizing the user. And I always think back to that gentleman with ALS, who, he had to choose between his liquid benzo for spasms or his pain medication. And we just have to continue to be, we remain steadfast in our advocacy. We have to take this to the DEA. The next step is to get on Capitol Hill with pharmacists by our side, with physicians by our side. You know, I'm not the person that does what I'm told to do. I'm doing something because I know it's right.
Yeah.
And that's what I just wish more providers were on our team. So we got to get those people out of prison. We've got doctors, they're in their 80s, they are behind bars. Did they use a lot of discernment? Probably not. Were they good businessmen or women? No. They were far too trusting, but they don't deserve to die behind bars. Neither do those pharmacists. So
Right.
we're,
You know,
we're just
you guys,
trying to-
I'm sure there are people that are in situations, pharmacists and doctors alike, that are behind bars because they dispensed medications. But there's a lot of people there. The system does work. There are pill mills that have existed. There are places where they've dispensed ridiculous amounts. They've taken cash prescriptions hand over fist. There are
Those days are so long gone,
necessary.
Shane. Like those days are so long gone where there's so many pill mills everywhere.
You're
that
saying that those so long gone. I will send you what just happened in Inland Empire. How a whole clinic was just shut down here. That all of that's just happened recently.
Yeah,
we
but-
can talk about it being like a time past. Maybe it was more proliferative back during the height of the opioid epidemic, but it still exists, and we do have to have some regulation in place. I'm not.
We do.
Yes. Yeah,
we
you
have
do
a
to
lot
some-
of regulation in place though. And
Yeah.
and what you were explaining about being empathetic, I want to thank you for that, because I can see in your face that you mean it, that you want to be there for the patient, and that you want to help the patient, and that just sometimes the system stops you from being able to do that. And I respect that. I don't know if I can explain this properly, but there's a difference between what you just said, Shane, and the pharmacists, both on social media and in real life, who just make fun of the patient and say, "You think I'm going to fill this? Get out of here." There's a difference. There's a difference.
I guess because I'm not on TikTok as much, I don't see
But
some
it's
of
in
the younger
person
generation.
too.
But
We have people record their
Yeah.
interactions with their pharmacies, where the pharmacist is literally making fun of them to their face, calling their name out in front of everyone, saying, "You think I'm going to fill your OxyContin? That's not happening." And it's just not. It's not okay. Like it's
I
not.
mean, I'd like to see those too, because we put up everything, the good and the bad. We call out pharmacists that are doing the wrong things. Any pharmacist that's ever in a situation where they're in front of a patient and they're doing that, the whole pharmacist community, the whole healthcare community should reject it. I've seen where the healthcare community has rallied behind patients when something happened. I don't remember what state it was in, but that whole clinic where they were taking pictures, this happened on TikTok, where they were taking pictures of the fluid, the fluid that remaining on that. So anything that's egregious like that gets called out. The medical student that was making fun of women's health issues.
Right.
So,
because
so
that's acceptable to call out, though, Shane. The vast majority on social media, or at least those who are willing to speak, are not going to speak up for somebody on a full agonist opioid who's treated poorly. It's actually applauded, at least where we are on social media, what we see. But
unless they're affected. Unless they're affected or their loved one.
Yeah, we've never seen.
Well, you advocate harder when it's your own loved one. And
we've never seen anyone though, Shane. We've never seen. This is the point. We haven't seen healthcare professionals rally behind pain patients or anyone who needs acute opioids for acute pain, chronic pain, end of life, cancer, whatever. We've not seen that happen. We're the ones having to rally. We see them make fun of us, but we haven't seen the rally. And I guess that's where my anger comes from, and resentment towards healthcare professionals on social media, because they're so willing to rally for issues that are acceptable, like you said, like reproductive rights or even opioid use disorder. But when it comes to someone in physical pain, it's just not socially acceptable to rally behind them.
Let me offer my platform, and every platform that I touch. From that, I would point you to places like, I know you had your issues with Dr. Katie Forbes, who made a crazy statement and said that I think it was in a joking way, but she also did some of the same things. She got everybody talking. She had made in passing, was she being funded by Purdue Pharma? But she also brought two communities together that sometimes are at odds and are getting people to talk to each other. I would point you to Pizza's Not Working and Dr. Bled Tanaway. I'd point you to RX Comedy. All of these platforms, we can advocate for patients. And you're right. The only way we can affect change is to have both of these communities come together and rally against the forces that are holding withholding these medications.
Even Buddy Carter, when he came to our event, he listened to our whole presentation, he spoke, and literally he said, basically was, you have to understand, you have to be careful. And Claudia said, because it's career suicide. And he was like, yeah. So that's the issue. Like, for politicians, for doctors, for healthcare professionals, even those who stand up for us, they have to toe that line, because if you are seen as someone advocating for a full agonist opioid access to, it could kill your career. It really can.
But it's changing. But it's changing now, because there's too many suicides. Like, too many people have died for this to go unnoticed. And just that last meeting with the senator's office, big change in the conversation than 9 years ago when I first met, because now people are applying pressure. People are canceling surgeries. People are saying no to those pain clinics. People are saying, you're not going to abuse me anymore. That's it. I'm done being abused. So that's the good part of social media.
I think that pharmacists are finding their voice as well. And the pharmacist community is. And sometimes they do it the wrong way. And sometimes they say some of those things, and you're seeing the worst of it. I think you see the best and worst of humanity online and through social media. You really do.
Can I say, I have the most amazing, I'm still friends with 2 pharmacists who retired many years ago. My pharmacists they've always been, they're like friends. I'm in a state that's teeny tiny. So, and people ask me, well, has this happened to you? I was like, no, I've never had a problem. The only problem I ever had was of being accused of being a drug seeker, which left me with a colostomy bag. But other than that, it's been, smooth sailing. Thank God. But, I think the time has come now, for the communities to come together and to take this off social media and take it to Capitol Hill. And I think the pharmacists probably have a little bit more power than we do as patients,
We have no funding. Like, I think you made a grifter saying something about, was it you or a different pharmacist said Claudia was a grifter? We, just so you know, so everyone knows who is listening, we have no grants, no funding. Our only source of income is through donations and through Patreon. Claudia and I make about $1,000 a month doing what we do. So there is no grifting happening.
And that's only recent. For the first 8 years, Bev and I, people laugh, but I say we dedicated our life to serving others, and we're going to continue to do that, because most of our constituents are bedbound. They're too sick.
And I would love what you said, Claudia. Like, if we could somehow speak off of social media, my dog's gonna bark, I'm sorry. If we could speak off of social media and figure out a way to try to affect change together. I mean,
Sid, you're welcome to join us on calls when we meet with senators. We'd love to have the pharmacist voice, because that's what we need.
I am all for this. I have, like I said, my focus has always been trying to help with workplace reform, because I don't know if you use CVS or you use Walgreens.
I do.
Any of these places, and some of them are really, the pharmacist is in a situation there sometimes where they're just overworked and they're understaffed. And there's constant turnover because technicians are not paid appropriately for the amount of work that they need to do.
Yeah, it's awful. It's awful when we see them
suffer because of it. There's medication errors that occur constantly because of this situation. So what we're advocating for is for technicians to be paid better, so well-trained staff stay in role and they understand all the little intricacies so they can get as many medications out to the patients as necessary. And you talked about all those patients out there that you've dealt with, that you've heard of suicides and patients that have ended their life because they couldn't deal with it anymore. I can't tell you how many pharmacists' stories that have happened over the last few years, and they're increasing.
Yeah.
Do you have statistics on that? That's something I'd actually like to post and speak about. If you have any information.
The most recent statistic is that the pharmacists have an increased risk over the general population for suicide.
If you could
And-
send me, I'd be happy to speak about that, because we hear about that with physicians, but I have not heard about that specifically from pharmacists.
One of our own that was advocating online for a long time, Todd and I both know him, Dr. Eric Geyer. He ran the political pharmacist page.
It was amazing.
Yeah, was an amazing guy,
Fellow
trying to do a lot of
podcaster,
stuff.
all about the patient, all about advocacy. Helped to start Pizza's Not Working, which then it manifested from just this little hashtag into this enormous campaign. So it's helping to change healthcare and what the pharmacists are going through and how they're connected. I wanted to take us upstream real quick before we have to wrap up. When I say upstream, there's forces that have pay grades that are much greater than all the money that all of our families will ever make over the generations of families that we have, in comparison to the pharmaceutical manufacturers who also are paying attention to the where the money is and how money works and how drugs are being developed. And I mean, there's human beings, there's shitty people in every sector of human beings. And there's pharmacists who can be jagoffs, and there's pain patients who can be jerkos. And I mean, there's all of us and what we go through. The same thing in pharmaceuticals, in the entire ecosystem that we live in. I've met with CEOs of pharmaceutical manufacturing companies who are so in tune to the mission because they've had a loved one or they've had someone that they know has been impacted by the disease that they're helping to literally eradicate or fight. And then I've seen, the memes of that, what's his name, Scalicity or his something Pharma Bro, where he's taking advantage and marking up a price.
Martin Shkreli.
Yeah. So I mean, and he, so we have people in every sector of healthcare that can be jerks that make the rest of us look like shitheads. And that's just the way it is. We're gonna have to deal with that. But I know the pharmacists that I've gravitated towards and supporting. They don't pay me. I promote them over and over and over again. All of my hosts, none of my hosts pay me anything. And I'm putting out their content. It's because I know that they're part of the change. And I know that what they're going through to get there. And I don't think either sides of our courts really understand the other sides, as people and as humans. And the way that Shane has just reached out to everybody on the planet from different sectors and the way that the two of you have advocated and been connected with, I do think that there's more that we're going to be able to do together, RX, together and being together and getting something done. And we should have next steps. We should meet back on This Week in Pharmacy, but I want to bring a senator or a state representative or someone who wants a platform, and then, sprinkle in other pharmacists who are pain advocates because they're out there. Shout out to, like I said, who we started this show, and I mentioned Dr. Jeffrey Fuden, who's very much missed in pain management. So
yeah,
there's others.
Yeah, he's great.
There's other champions too. So I want to thank Shane. I'm going to kind of give you the last word on your mission, because I do want to give a shout out to the union work that you're doing. If you'd give us just a short update on that.
Yeah, so the update on that is the Pharmacy Guild has active campaigns in almost all 50 states. We've won elections in Rhode Island. We have two of the 24-hour stores that are some of the busiest CVSs in the country that are bargaining their first contract. We have CVS Specialty in Redlands, California, that's close to their very first contract. We have multiple stores of Safeways in Washington State. We have Providence Hospital, where all 72 pharmacists have voted to won their election. So there's stores in Arizona. We can change a workplace. The Pharmacy Guild can go in and unionize a store with 2 pharmacists and 3 technicians, or we can unionize a facility like CVS Specialty in Redlands, where all 125 technicians are getting close to having their first contract. I think that this is where the intersection of doing the best for chronic pain patients and my work comes together. If we can fix the labor piece inside these pharmacies, A chronic pain patient who's having any difficulty filling a prescription will be able to go in and have a pharmacist that can give them 10 minutes, 15 minutes of their undivided attention and explain what they can do to get their medication today, whether it be in that location, let them know what the issue is, what they have to do, whether it be the insurance is stopping it, whether it's the arbitrary rules of the company they're trying to fill it with, anything, what their concerns are. When that discourse happens and you turn a customer into a patient, you avoid all of those problems. And if our team and the Pharmacy Guild and all the people that I work with can change that culture inside of a pharmacy, we can better serve every patient out there. So it's a win. And I think the way that we can work together is if we're on the same team and we advocate for you and you advocate for us, there's real power in where you go to fill your prescriptions. I want to let every chronic pain patient know. You said, Claudia, you're the face, you're advocating for people that are bedbound. There's still power in numbers for all of those patients to take their business somewhere else if they're not bargaining in good faith, if they're an understaffed pharmacy. Show them with your prescriptions, show them with your business and your insurance and all the things that they're billing. Show them that you have power. You can affect change. And I am all in. I will help you guys wherever I can, even if it's just sharing it, even if we have to put up something a little bit sensational to get people talking. And let me end this by saying I apologize wholeheartedly for anything that seemed a little bit offensive or off color that I posted after that original Harmacist video, but I was doing it with the intent of getting us together and getting people together to make real change. Thank you guys for having me. I really appreciate it.
Yeah, thank you. Claudia and Bev, you're going to be coming back for sure. I want to do more maybe focused groups and anything that you need for me to help you guys strengthen relationships with providers. Because like I said, I can't help the patients. You guys are on the front line. So are our pharmacists and our technicians, and they want what's best. I have up on the screen, if you're watching on YouTube or one of our live streams, it says the doctorpatientforum.com. That's doctorpatientforum.com.
Yeah.
But in wrapping up, I want to give last word to Claudia and Bev.
Well, I think people are going to be angry that it wasn't more hostile, and we ended on. So I'm sorry, listeners, that because we don't come from a place of hostility, we come from a place of help. So I hope people aren't too disappointed, because I'd love to have Shane. I'm sorry, that's so bad. That's my menopause. I probably need an increase in my estrogen. But we'd love to have Shane come on our podcast, because our constituents really need to understand what pharmacists are going through, because they're in a pressure cooker. I know. I get it. Like I said, they're in prison. There's some people in prison. They don't belong there. So thank you, Todd, for this opportunity.
Absolutely, Bev. Thank you.
I just want to say, like, one thing I didn't touch on, I'll do it really, really fast, that I really want to just address is one thing we fight for with the Doctor Patient Forum that has to do with pharmacy is actual harms from the PDMP, and for data analytics programs like NARCS Care and the red flags, because these red flagging systems tend to flag the sickest patients, and then they cause the very thing they're trying to prevent. Like you said, go to a different pharmacy, but see, then that's a red flag for the patients, and then their NARCS Care score can go up, or if they don't have it in one pharmacy, going to another again. And so a lot of times there aren't pharmacies within 100 miles of a patient. A lot of times the pharmacy doesn't have the medication, a certain MME or whatever. We have an open NARCS Care petition that we submitted to the FDA, a citizen's petition asking them to declare it as software as a medical device so that it can be regulated and transparent so people actually know what goes into it. I'm not saying the PDMP is just harmful, but there is not a lot of focus on the harms that come from the PDMP, what it actually does, what we know it does, and what it might do. And so I think there needs to be more research there. So this is just something that we focus on also. I just wanted to let you know, Shane, that is part of what we focus on, because I know you're given those tools to try to determine things, and sometimes they're not the best tools that you're given. But I do appreciate your kindness and your empathy, and I like Claudia. I think people will be mad that we're not screaming at each other. But Todd, thank you. You're always the best. I love Todd. I like stick up for you. Anytime anyone attacks you on social media, I feel like I need to be like, no, Todd's our friend.
Oh, don't do it. I'll move around. I always dodge it. I got that Gen X skin too because it's you had to. I got made fun of in Catholic school for having a big head, and it's.
Todd, how old are you?
I'm 52.
So we all, yeah. So I was 76. You were born in what, 74?
72.
72. Oh, 72.
You mean I'm the youngest on here?
You are,
Yeah,
Shane,
you
for
definitely
sure.
are.
I'm
You're
48.
millennial.
I am 48. So
Todd,
Yes.
if you were born in 72, you're not 52. I just
I'm
wanted to let you know
54.
that.
54. I can't. I'm not getting. It's just getting old.
But Shane, we would like to have you on the podcast. We'd like to continue this conversation.
And I would, and believe me, I know that people are going to be a little bit upset because they're going to say, look, but I wanted to try and have that human connection. We could have turned this into a debate, but I didn't want to do that because I don't think that's beneficial
We
for
can
any
do it
one of
again.
us because we are on the same team
Yeah.
ultimately. And we need to fight the forces that are preventing us from really doing our job and really servicing the patients, all patients.
Yeah. Shane, can you give us your contact information after so that we can I'll send you some of that stuff. And
I
Todd,
sure
if
will.
you want that one podcast with Tim Atkinson at Pain Week, I can send it to you if you want so you can see what I'm talking about. I called him to see if I contacted him to see if he'd come on our podcast, but he said something like those who I don't know, he has restrictions on where he can go, but maybe he can go
Yeah.
on your podcast. It's been a few years, but he seems great. He's fighting. He did research, I guess, on patient abandonment and forced tapers. So
Shane, are you trying to organize pharmacists? Is that what you're trying to do?
Yeah, so myself, Dr. Bled Tanaway, Dr. Maurice Shaw, and Dr. Lonnie Duong. By the way, I don't call myself doctor ever. The only thing it's on is my checks. So I wanted to let you know I'm not part of that generation who insists on that. I'm a pharmacist, and that's what I want to be. I don't want to be a doctor. We started advocating years ago, but during the walkouts that occurred in Kansas City, there was a bunch of pharmacists who got so upset with the CVS targets out there, they decided to walk off the job. And a lot of them wanted to be able to put stuff out, but they were worried about losing their job. And I ended up being the voice on television to get their word out. So we organized after that, like CVS tried to play it off like this is very specific to this area of the country. It doesn't happen everywhere, but because of a platform like the Accidental Pharmacist, everyone was saying how, this is happening everywhere. Pharmacies are understaffed everywhere. There's so many, we're worried about making mistakes because of the way that they're staffing these locations. So during that time, I ended up being on Fox Business and CNBC and NBC, and there was print articles everywhere. And at that point, IAM Healthcare, which is the International Association of Machinists and Aerospace Workers, they have a smaller healthcare wing. They gave us the resources to launch the Pharmacy Guild. So we're part of IAM, but we're our own entity that only represents pharmacists and technicians. And we have close to 1,000 members right now. We're still bargaining their first contracts, and we've grown a lot, but we still need more. We have full-time organizers in Florida, in Michigan, in California, in Arizona, and we actually need more because there's lots of people that want to organize these places to have safer working conditions.
yeah, that's great.
Oh God, yeah. I'm
Great.
pro-union all the way. I come from union blood, so I know the importance of organize. I mean, I tried to organize doctors years ago,
Yeah.
but apparently it's illegal for doctors to organize. But I was like, who gives a shit?
Well, it's changing now. I mean, it is because there's lots of residents that are actually trying
That's
to
right.
organize.
Yeah.
But the thing is that it's very difficult. If it wasn't for IAM they put a lot of resources in. We've been at the American Pharmacists Association conventions every year. We've had our own convention here in Palm Springs. They've really put a lot of resources into trying to change this industry and really rein in the control that CVS Caremark has on what pharmacists do and what our careers look like.
Yeah, that's great. Shana, I would love to have you on our podcast just to talk about that.
Yeah.
Can I say something off the record, like really off the record?
Sure.
So,
We're still recording.
Oh, really? Oh, no, I can't say it then.
All right, just let me shut TWIRx down.
Okay.
We appreciate you all listeners out there. Please share this with someone that you know should be hearing it, another pharmacist, somebody in pain management, also reach out to Claudia and Bev and Shane. Thank you so much for being on TWIRx. It's always great to see you, and can't wait to have you back.
Thanks a lot. Pharmacy on.
Peace.